Good evening po, Doc. Good evening, everyone. Welcome to Visual Diagnosis. Tonight, let us focus our discussion on complexion and lustre. The color and lustre of the complexion are the outward manifestations of the internal organs of yin, yang, qi, and blood. If the internal organs function normally, and if yin, yang, qi, and blood are abundant and balanced, the complexion will have normal color and proper luster. Conversely, when qi, blood, yin, and yang are weakened, and the internal organs are affected, the complexion acquires as abnormal color. The chapter on observation of the color in principle and prohibition for the medical profession says, when the 5 yin organs are exhausted, the complexion color becomes dark and lusterless. So, the complexion color is like a flag of the spirit, and the yin organs are the residences of the spirit. When the spirit is gone, the yin organs are worn out, and the complexion color becomes dark and lusterless. Okay? As the above passage indicates clearly, observation of complexion color is a very important diagnostic tool to assess the condition not only of qi, blood, yin and yang, and the internal organs, but also of the mind and spirit. Indeed, from a 5-element perspective, the facial complexion as a whole is a manifestation of the heart and therefore the mind and spirit. This should never be forgotten in practice, okay? Thus, if a woman has a very dull, sallow complexion, it does indicate a spleen qi deficiency and dampness and possibly also blood deficiency. But at the same time, it also indicates that the mind and spirit are affected and suffering. Yu Chang, in Principles of Medical Practice, calls the complexion the banner of the mind and spirit. And he says, when the mind and spirit are flourishing, the complexion is glowing. When the mind and spirit are declining, the complexion withers. When the mind is stable, the complexion is florid. The normal complexion should have luster and moisture. Luster means that the complexion color should be bright, glowing, and with a shine to it. Moisture means that the complexion should look moist and the skin is firm, indicating that there is moisture underneath it. There is a correspondence between these two aspects of the complexion and two of the attributes of the normal pulse. Luster of the complexion corresponds to the spirit of the pulse, while moisture of the complexion corresponds to stomach qi of the pulse. Thus, we can say that if the complexion has luster, there is spirit. If it has moisture, there is stomach qi. Okay? Observation of the complexion must be closely linked to the feeling of the pulse. The pulse shows the state of qi, the complexion of state of the mind and spirit. If the pulse shows changes, but the complexion is normal, it indicates that the problem is present. If both the pulse and the complexion show pathological changes, it indicates that the problem is long-standing. The luster of the complexion should also be checked against the luster of the eyes. A change in the complexion always indicates a deeper or more long-standing problem. For example, a sustained period of overwork and inadequate sleep may cause the eyes to lack luster and the pulse to be weak. If the complexion has not changed, this is not too serious and the person can recover easily by resting. If, however, the eyes lack luster and the complexion is dull without luster or dark, it indicates that the problem is not transient, but deeper rooted. Thus, in terms of time scale, the pulse changes first, the eyes second, and the complexion is the last. Accordingly, if the pulse is affected but the eyes and the complexion are not, the problem is very present. If pulse and eyes are affected, like lacking in luster, the problem is older, maybe some months. If the pulse, eyes, and complexion are all affected, the problem is even older or over 1 year. Now let's go to dominant colors. The normal complexion color varies, of course, according to the racial group, but also according to the element types. Wood types have a subtle greenish hue to their complexion. Earth types, a subtle yellowish hue. Fire types, a red hue. Metal types, a metal hue. And water types, a dark hue. Therefore, the normal complexion color is determined by race and prenatal influences and, in health, remains the same throughout life. In disease, the complexion color becomes pathological and will vary, obviously according to the racial group, but also according to element type. For example, a pathological yellow color in someone of the wood type will be subtly different from that in someone of the fire type. Such differences in pathological color are, of course, even more evident in different racial groups. For example, the paleness of the Caucasian patient will differ from that of an Asian patient. The basic inherited complexion colors determined by race and element type are called dominant colors. The chapter keys of the 4 diagnostic methods in Golden Mirror of Medicine says, the colors of the 5 yin organs manifest in people according to their body shape based on the 5 elements. Such colors never change throughout life. They are known as dominant colors. In addition, there are other factors related to environment and season that influence the complexion color. Environmental conditions and lifestyle have an important influence on complexion color, so that what is a normal complexion color for one person may not be so for another, even within the same racial group and element type. This should be taken into account when diagnosing patients. For example, the normal complexion of a farmer who spends most of his life outdoors will obviously be different from that of an office worker. Inevitably, the farmer's normal complexion will be redder than the office workers. In chapter 12 of the Simple Questions discusses environmental influences on the complexion. The East is where chi of all kinds of life in nature starts. It is an area close to seas and water and abounds in fish and salt. People who live in the East eat a lot of fish and like salty food. Therefore, they often have a relatively dark complexion and loose structures between the complexion and muscles. The South is where all kinds of life in nature grow vigorously, and where yang flourishes, it is lower terrain and has poor water and soil. There is often fog. People who live in the South like sour flavored and fermented food. Therefore, they often have a relatively red complexion and dense structures between the complexion and muscles. Okay? Obviously, the geographical references in the above passage refer to the China, and the Italian references refer to ancient China. However, the principle that the environment influences the complexion color is still valid. To summarize, the dominant color of the complexion is determined by element type, race, and environmental influences. Now let's go to guest colors. Guest colors are those appearing on the connecting channels of the face and limbs. The colors of the yin connecting channels follow those of the main channels. That is, if the main channels manifest with red color, the yin connecting will also manifest with a red color. The yang connecting channels are on the yang surfaces, and being more superficial, they are more readily influenced by seasonal factors. Thus, the complexion may assume a certain color due to the seasonal and climatic influence on the yang connecting channels, and such color may contradict what one might expect from the element type or pathological condition. For example, a patient with a pathological condition of the heart, such as heat, should have a reddish complexion. If the seasonal and climatic influence, like spring on the yang connecting channels, predominates, the complexion may instead be greenish. This is called guest color, and we should be able to recognize it in order to explain the anomaly. Chapter 57 of the Simple Question says, the Yellow Emperor asked, the connecting channels are exposed to the exterior and manifest with 5 different colors, which are green, yellow, red, white, and black. What is the reason? Chi Bo answers. The main channels have their regular colors, but the colors of the connecting channels change according to the 4 seasons. The Yellow Emperor asked, what are the normal colors of the main channels? Chi Bo answers. Red for the heart, white for the lungs, green for the liver, yellow for the spleen, and black for the kidneys. The Yellow Emperor again asks, do the colors of the yin and yang connecting channels correspond to the regular colors of the related main channels? Chi Bo answers. The colors of the yin connecting channels correspond to the regular colors of the related main channels, while those of the yin yang connecting channels change in accordance with the 4 seasons. In cold weather, the circulation of qi and blood slows down, and there is often a green or black color. In warm and hot weather, qi and blood circulation is free and smooth, and there is usually a yellow or red color. All these are normal phenomena, indicating the body is in a normal condition. When the above passage talks about the normal colors of the main channels, it refers to the 5 main pathological colors of the face, which are produced by the influence of the main yin channels. For example, a pathological condition of the main channel of the heart may produce a reddish complexion. Of course, this is seen strictly from a 5-element point of view. As for example, heart blood deficiency would manifest with a pale rather than red complexion. The passage then explains that while the color of the yin connecting channels accords with the predominant face color, that of the yang connecting channels is influenced by the seasons and climate. Bearing in mind that the limbs are richly supplied by the yang connecting channels, one needs to observe the color of the limbs as well as the face to gauge the seasonal influence of these channels. Such colors, compared with those deriving from racial group and element type, are temporary and reversible and are known as the guest colors, which are not pathological. It is important to differentiate between guest colors due to environmental and climatic influences and actual abnormal colors due to pathological conditions. Now, to summarize, the guest complexion colors are influenced by seasonal and climatic factors. Clinical significance of complexion color and luster. Observation of the complexion color and luster helps us to determine the pathology, location, nature, and prognosis of a disease. When observing the complexion color, attention should be paid to distinguishing the dominant colors, the guest colors, and the abnormal colors. It is, of course, necessary to refer to the pulse, tongue, and symptoms, and also to take into account the patient's element type. For example, if someone of a wood type has a slightly greenish complexion, this is in keeping with that type. If this person's complexion develops a reddish tint, perhaps a superficial redness over the underlying greenish color during the summer, this is a guest color and is also normal. However, if the same person's complexion is very red and deep, it indicates not a guest color but a pathological condition of heat. Thank you so much for your attention.